Let's talk a little bit about what you should know in regards to arthritis and pain. These are two things that we typically hear put together so often. However, they don't always need to be. We know that arthritis is a typical and normal process that occurs with aging. We know that joints are going to kind of break down a little bit. We know that there may be a little bit of unevenness of a bony structure as we get older. But the one thing that is not normal is the pain, weakness, and stiffness associated with it. Those are things that are kind of self-perpetuated over time. They're things that, you know, can somewhat be avoided. And obviously, arthritis can be painful. I'm not saying that it can't be, but a lot of the time, the pain that comes along with it, or what we may think is arthritic pain, isn't necessarily always related. Now, pain that has to do with arthritis is typically not acute. It's typically not, it typically doesn't just come on overnight. It's not something that all of a sudden just shows up. It's something that has a gradual build. You may start to feel it intermittently. It then becomes a little bit more constant. And that's how arthritis pain typically works. But in regards to acute pain, if you've all of a sudden gone out one day and raked a whole bunch and the next day you're feeling really, really uncomfortable, I don't necessarily think that's 100% correlated to arthritis. And there's the reason. We typically don't see acute pain correlating with arthritis. I already said it. Acute pain typically comes from things such as muscles, tendons, ligaments, bones, that type of thing. And when I say bone, I mean more of a traumatic kind of bony injury, so a fracture. We don't typically say, hey, you know what, oh, I just went raking, my arthritis is acting up. A lot of people correlate those two together, but that's not always true. When we have acute pain, it's typically from doing something that you haven't done a lot. And an example I love to give is that I have some people who come into the clinic and all of a sudden they say to me, hey, you know what, like, I really, really needed to do yard work, or I really wanted to see my granddaughter's recital, so I had to go up and down a flight of stairs. And all of a sudden, things started to hurt so much more. Well, guys, it's overuse. It's something that you don't do often. It's something that you've avoided for a really long time. And unfortunately, your body's not prepared to do so. If you've avoided it and you haven't done it because you are fearful of pain, guess what? More than likely, when it happens, it's gonna cause pain. And not necessarily just due to your arthritis, but due to the weakness and the lack of mobility surrounding those joints that may be arthritic. It may have nothing to do with the arthritis situation in general. A lot of people have come into me and they say, hey, you know what, like, all of a sudden I started running, I went to the doctor, I had an MRI of my knee, and I had arthritis there. But the question I ask them is, have you had knee pain in the past? Has this bothered you before? And if the answer is no, then I typically know that that pain doesn't have to do with the arthritis changes that are seen on x-ray. Remember that. Just because you have arthritis, it doesn't necessarily mean that it's the cause of the pain. I can go on about this. I think it's one of those things that people really need to recognize is that if you do have pain and you have arthritis, acute pain that you wake up with the day after doing something that may not be all that smart because you haven't done it in a really long time, doesn't mean that it's your arthritis. Could very well just be the muscles and stuff around it. So guys, think about this a little bit. If you have arthritis, we need to keep you moving. We need to get the joints moving. We need to get the muscles moving, and we need you to work hard. Yeah, I said it, work hard. Sitting down and doing nothing with arthritic joints is going to make them achy. It's going to make them uncomfortable. Each joint has a lubricating fluid. The more we sit, the less it's going to want to move. It's like starting a car that hasn't been started in a really long time. If we go ahead and we try to start it, it's probably not going to want to, and it's probably going to be really grumpy and burble a whole bunch. And our bodies are going to do the same. And they're going to complain if you do go and take it on a ride. Especially if it's something or a ride you haven't gone on in a really long time. So think about that. Keep moving. If you're not one who likes exercise, practice sitting down and standing up from a chair. Find somebody to motivate you a little bit more, to get walking, to do more activity. Research shows that exercise is one of the #1 things that you can do to combat the stiffness, weakness, and pain associated with arthritis. Sounds crazy for some people, doesn't it? But it's true. The more we move, the better our joints feel. We are creatures that are made to move in different ways. And if you can't find the right ways to move for you, then let us step in and help. it's one of the things. You need to do it. You need to move. You need to keep your joints mobile in order for pain to dissipate. So guys, if you have questions about this, please feel free to reach out. I can go on and on about this, and I think a lot of other healthcare practitioners can as well, because it's so important to recognize the more we sit, the more we don't use our bodies, the more discomfort we're going to be in, because we're not strong enough to tolerate the things that we need to do on a daily basis. So, all right, I hope everybody's doing well. We're entering the holiday season. You know, enjoy the time that you can with the family members that you have available to you, whether it's even in person or via Zoom. And you know what? I'll be back soon with another topic. And yeah, bye guys.